Good. Well, good evening, everyone, and welcome to our Tuesday evening introduction to Lifewave, the technology, a little bit about our founder, a little history on the company, and we are here to share this very special company with all of you. So what we do, I am one of your co-hosts, Robin Blank Mascari, along with my partner, Gregory. And what we're going to do is a short presentation followed up by an introduction and sharing from one of our amazing practitioners. This evening we have Dr. Stuart Freedenfeld. Always a treat to have him. And then it's your turn. So if you have stories or questions, please put them in the Q&A. And thank you for remembering symptoms only. So we're excited to get the ball rolling. So I'm going to turn things over to you, Gregory.
Great. Well, thanks, Robin. And I'm going to go ahead and share my screen. Hold on one second, please. Are you seeing my screen?
Yes.
No, not yet.
Yes, I do.
Stop share.
I see your screen. I saw your screen.
Okay. There, let me do it one more time. Great. Okay, so we're going to talk to you today about activating your stem cells. And before we do, I'm going to share with you my own personal realization I came to a number of years ago. I finally figured out what I want to be when I get older. Younger, because getting old isn't so cool. And so let me ask you a personal question. If anything were possible, what's one thing you choose to experience differently in your health or in the health of someone you love and care for? And what difference would that make for you and or them? And with that being said, I want to make a note that our products are not designed or intended to heal, treat, or diagnose any disease. They do, however, help our bodies get back into a more healthy, regenerative mode, and many times wonderful things then begin to happen. So let's get started and talk about the stem cell revolution, because we believe everyone wants to look, feel, perform, and live younger. And stem cells are the key because they're a vital part of our immune system that helps to repair and regenerate damaged cells in every organ, gland, bone, muscle, skin, all throughout our body. Here's the problem. The older we get, the less stem cells we have. And by age 60, only a small percentage remain. And sadly, the fewer stem cells we have, the faster we age and the slower we heal. And so what about stem cell injections? Because they become quite popular, but they're also quite expensive. They can be painful, risky, controversial. You know what? You could spend thousands or tens of thousands of dollars with no guaranteed results. Well, our good news today is you can look, feel, perform, and live younger with our historic breakthrough in stem cell activation. It's a new wearable technology in patch form. It's affordable, it's safe, it's non-invasive, it's drug-free. It's a patented form of phototherapy that uses very specific frequencies of light to increase and improve our stem cell activity. Now, this is the brainchild of our visionary founder and CEO, David Schmidt. And David is not only a brilliant scientist and researcher, David's really a genius inventor with over 130 patents and patent pendings. And he's been on the leading edge of phototherapy research and science for over 20 years. David's already conducted over 80 clinical studies, many of them double-blind, placebo-controlled studies, proving the efficacy of our Lifewave phototherapy products. And many more studies are always in the works. And that's because Lifewave is a very science-based advanced technology company. And it was started back in 2004 based on an energy-enhancing technology that David developed for Navy SEALs to increase their strength, stamina, and performance without the use of drugs, stimulants, or caffeine. And it turned out to be so effective, it's now used by world-class athletes around the world in almost every sport. I'm happy to tell you I have corporate headquarters, laboratory, and manufacturing diversified between California, Utah, and Ireland. And we have global distribution to over 75 countries with our 15 global distribution centers. Now, the word is getting out on Lifewave. And as I said, our patches are used by pro and amateur athletes around the world in almost every sport. The media begin to notice, and you might too, if you look carefully at some of your favorite athletes and you see the auspicious little white looking like Band-Aids on their body. and those are the Lifewave patch technologies. So how does this amazing technology work? And it's based on a type of light therapy called photobiomodulation. And Lifewave patches contain very specific combinations of organic materials and nanocrystals. And when applied or near the body, they're activated by our body heat. And then they begin to emit very specific wavelengths of light, which stimulate targeted and beneficial biochemical responses in our body. And this is known as photobiomodulation, and it is the basis of our Lifewave phototherapy patches. Now, it's been a very well-recognized and proven scientific principle that different frequencies of light can cause specific changes within our body. For example, when we go out in the sun, a very specific frequency of light causes our body to make vitamin D. We're not getting a download of vitamin D from the sun. We're getting a download of a light frequency that tells our body to manufacture vitamin D. And likewise, another frequency of light causes our body to make melanin, the chemical that gives us a suntan. Well, Lifewave's patented technology is based on the same rock-solid, well-recognized scientific principle. And a focus for the last 14 years has been in the field of anti-aging and regenerative science. And I'm happy to tell you that in January of 2019, we released to the global market the Lifewave X39 stem cell activation patch, which truly is a historic and affordable breakthrough in stem cell activation. Some are calling it the holy grail of anti-aging restorative science, because we're actually doing what the multi-billion-dollar companies and big pharma have not been able to do. And that is X39 actually activates a very specific copper peptide that activates our body's own stem cells, while also altering gene expression towards a younger and more vibrant you. So X39 certainly is a game changer. It's a true breakthrough. And David, our founder and CEO, says it's my greatest achievement yet. Now, yes, we have patents. Yes, we have clinical studies. And yes, we have field results proving that X39 is actually turning back our biological clock, helping people to look, feel, perform, and live younger. And for us baby boomers, this is very, very exciting news. So that's what I had to share just to kind of kick things off here tonight, Robin. So I'm going to turn it back over to you and to our special guest, and I'll promote him out to co-host so he can be on here with you.
Well, thank you, Gregory, as always. This is turning out to get better and better. And so it is my privilege to get to share with you tonight our special guest. And at Lifewave, we have so many really gifted, wonderful practitioners that are open to new technologies, that are open to what's really going to be best for their patients and clients. So tonight I get to introduce Dr. Stuart Freedenfeld, who is an MD, and he started out as a family practice doctor, and then he went on to become a lecturer, and then he was an instructor at Rutgers Medical School. And then something very interesting happened. In 1988, he expanded his horizons and integrated all kinds of other natural medicines with what he was taught in medical school. So herbal medicine, nutritional medicine, IV therapy, all kinds of different ways to really give his patients choices on what would be best for them to get where they wanted to go. And we love having Dr. Stuart on. So I want to welcome you this evening, Dr. Stuart. You want to unmute and show your camera. There he is.
Hello.
Hey, hope you had a wonderful holiday.
Thank you. It was nice.
Yeah. Did you bike ride?
No, we're visiting a family, and went to see the Pops and the fireworks.
All right. Well, Dr. Stuart is our youngster in the bunch, and he's still hanging out with the youngsters on the soccer field. And we'll get into that in just a minute. So let me start out by asking you, what is it that got you interested in really taking a deeper dive into looking at Lifewave? And then what are some of the changes you've seen with people using this technology?
I guess medical curiosity. I was introduced by a dear friend that I've met on the lecture circuit, who had her own personal excellent results, and encouraged me to give it a try and see what I thought. And I had excellent personal results, very rapid onset of results, not necessarily what we see across the board, but it was certainly a pleasant experience to get the kind of benefits that I saw on the soccer pitch and in my personal life.
Great. So I was bragging about you today, by the way, because I was speaking to a 74-year young world-class athlete who's holds a world record, and she's a duathlete, and I was telling her about you. So you're out there playing soccer with. Please share how many years young you are and what age these kids are that you play soccer with.
I'll be 74 this year, and in the team play, it's over 40, and on Sundays we'll have to pick up with 20-year-olds, 18-year-olds, and whoever shows up.
Love it, love it. So I bet people on the field go, I want to be like him when I grow up. They probably don't even know, because you certainly don't look your age. And isn't that fabulous? And I was telling her about the results you're getting from X49, but we'll get into that in a little bit. Let's get back to X39, which is the star of the show that Gregory shared about. So who is this technology for, X39?
I mean, anybody could use it. It has regenerative, health maintaining benefits. So a young, healthy person who uses it might find that they stay youthful and feeling good until they're 80, 90. And they could look back on their life and say, I felt great the whole time. I probably didn't need it. You know, it's just, and of course, the people who are not feeling well and have issues, especially pain issues, healing issues, it can have a transformative benefit.
Beautiful. So earlier you said you had quick results, but not everyone does. Could you share a little bit more about what people can expect when they start using X39 and the Lifewave patches?
I think in my experience, people who have specific pain, acute pain or chronic pain, will see the most noticeable benefits. Of course, the more chronic the pain, the longer it will take to see the benefits. But in my case, from a sports injury, recent, got better within actually 10, 15 minutes of putting the patch on, which just seemed ludicrous. More recently, I had a shoulder injury that I ignored for 3 months, expecting to go away. Finally patched it, and within 2 days, the pain was gone. I had my range of motion back. And the same with a neck injury that was bothering me for a few months before I started treating it, and it also went away in a couple of days.
So it can be pretty quick, or it could take time.
Yeah, but sometimes it'll take, especially with more chronic injuries, it may take a month, 2 months, 3 months.
Great.
And with injuries with pain, we'll typically apply the patch directly over the pain site rather than in a general healing place like the back of the neck or under the belly button.
Okay. So you recommend people give it a try for several months before making a decision, yes?
Well, I think, and again, it depends on what they're looking for, what their focus is. For general health, I would suggest trying it for the rest of your life. For the acute illness, you want to say, is this going to help my shoulder pain or my elbow pain? Give it at least a month, 6 weeks, and preferably 2 to 3 months if it's been a chronic injury.
Beautiful, beautiful.
And,
so what
consider adding other patches to it if with chronic injuries. We could talk about that now or later, whatever you'd like.
Okay, great. So you talked about X39 being the regenerative patch, and how, what are the optimal conditions that you recommend for people to get the maximum benefit out of utilizing this technology?
Have a healthy lifestyle.
Yeah.
Now, we often talk about the fluid requirements for these patches to get their full benefit. But I think also just everything. You can't expect to work in the Lincoln Tunnel, smoke cigarettes, drink alcohol, and eat fried foods and have a health regenerative benefit from anything you do. So you want to give your body the best chance to swim upstream in that stream of life, by eating healthy, by avoiding toxicants and harmful products, and even emotionally damaging feelings, thoughts.
Beautiful. And what about how long do you use it? How do you use it?
So the patch is typically applied for 12 hours and then give your body a 12-hour rest period to be able to recharge and be able to respond again 12 hours later to a new patch. Sometimes I'll leave a patch on for 14, 15 hours and then off for the rest of the day. It's just not convenient always. You take the patch off when you're in front of the mirror brushing your teeth. So
Yeah, I find the toothbrush, that's where I keep my patches. That's
for
my,
everything,
it's my reminder. So it's okay if it's on 14 or 15, but you want to give your body a break from the patch. Any
indeed.
other things that people should remember to get the maximum benefit from utilizing the patches?
Some people with X39, you may need a copper supplement. Some people may need a glycine supplement. The X39 stimulates a tripeptide. Glycine is one of the critical components of that tripeptide and maybe the most commonly deficient. And copper is a activating mineral that allows the GHK peptide to stimulate the stem cell production.
Beautiful. So we do recommend that people do your own research on this copper peptide. We should really call the patch the copper peptide patch, but people wouldn't have a clue what that means. And so the copper peptide does many things. One of them is activate your own younger stem cells. So it is really important. So maybe some supplementation, putting the patches on 12 hours on, 12 hours off approximately. And some people actually set their phone alarm as a reminder, just 7 and 7, 8 and 8, 9 and 9, 10 and 10, whatever fits with your lifestyle. And it's okay if it's a little bit longer, and you're not going to hurt yourself if you leave it on too long. So are there any negative side effects from utilizing this technology?
I have not experienced any. I think some people may find that they feel sleepy. Well, put it on at night instead of in the daytime. But by and large, there is really no risk and no unacceptable side effects, or even any side effects for most people.
And is it okay if people are on medications?
It's not introducing any chemical into your body. It's utilizing energy in the form of infrared rays that are transmitted from your own body heat, activated in the crystals of the patch, and those rays stimulate the signaling molecules that turn on a biologic process. With the X39, it's turning on the production of GHK.
And this is so exciting. There's nothing going in your body other than a frequency of light that your own body generated. So no contraindications. How exciting is that? Yeah. That's wonderful. So any other final comments before we open up for stories and questions?
We can go to questions.
Okay. We will jump into questions. So just a reminder to everyone, please put your questions or your stories in the Q&A section, and a reminder to symptoms only, no naming of any dis-ease. We're a natural products company and we don't talk about diseases, we just talk symptoms. So let's start out, and please put them in sooner versus later, because if you wait till the end of the half hour, then we won't have time for you. Okay, Sunshine Rose would like to know, someone on my team has had swelling and discoloration of the legs for 20 years. Thus far, only minimal results with X39. Do you have any other suggestions?
Um, hmm. Well, the swelling and discoloration is probably due to pooling of venous blood, and using support stockings that add pressure around the leg veins. The muscles contracting when you're walking pump the blood out of there and will help to relieve them, plus elevating the legs as much as possible.
Beautiful.
You know, if you're not walking, put your legs up.
Okay, elevation definitely helps. And, lying on your back and put your feet up the wall, huh?
Yeah, feet should actually be above your heart level.
Above the heart level. Very good. Very good. Thank you. Any other patches?
Um, hmm. Hmm.
What about the
Well,
energy enhancer?
with that's an interesting thought. It does improve blood flow. That may be helpful. It's an interesting thought. So if you were using the energy enhancer, would you put them, where would you place the two patches in your experience, Robin?
I would say kidney 1 on the bottom of the feet.
Okay, so the white on the right foot pad and the tan on the left.
From one of our practitioners, Dr. Welt, who's an acupuncture physician, and Dr. Nicholas says, we need energy for everything. So why not? Increase the energy flow. Okay,
Real energy production.
there we go. Okay, Meredith is asking, what patches and placement would you recommend for someone who has severe dizziness and currently unable to change position without triggering it? There are body aches overnight and sinus pain, blocked nose, also challenging her.
So I guess question, dizziness is one of those things that it's a common word that has many meanings. Is this a spinning sensation, a vertigo sensation? Is it a wobbliness? Does it occur when you first stand up that you get lightheaded? Is it dizzy all the time, just an unbalance? So maybe
she said triggered by changing of any position.
Changing of any position. So, and is it a spinning sensation?
Yeah, Meredith, why don't you mention that in the chat so we can get back to you and see, because there's, like Dr. Stewart is saying, there's several different kinds of dizziness, and we want to get a little more specific for you. Okay, so why don't you just mention that in the chat, and we'll come back to you. Shelley said her husband's having issues with elevated blood pressure and snoring, and at times he stops breathing briefly. He's on the Y-age at night and X39. I'm not sure which Y-age because there's 3 of them, and X39 during the day. We've tried X39 on the inside of his arm as well as the usual place on the back of the neck. We tried X49 for a few days. We've tried Eon on the pineal gland and glutathione at the base of the neck. Do you have any other ideas?
Well, that's the Y-age. Well, obviously, we're talking about a sleep apnea, a pausing in the breathing pattern during the night. Weight loss is very important for most people with this kind of a breathing problem during the night. Not smoking, the mechanical assistant and ventilation can be just really, really helpful. And where patches and supplements may be helpful, if you're really having a sleep apnea problem, then look into getting the breathing apparatus, because it will help to lower your blood pressure and increase your life expectancy. It's not something to be ignored.
Okay, important to go see your practitioner with that one and get the best support possible, because that could be very dangerous. Yeah, thank you. And we always recommend you go to your practitioner, and that they don't always know about the patches, but you're on the right track with the patches too. Okay, thank you. Glenn Olson, Dr. Stewart, if you have a constant cough nonstop, no fever, and can't get anything up, what patches would you recommend?
No phlegm. Yeah. Well, okay. So one thing I would think about with constant cough and no phlegm would be a reactive airway disease, asthma type of thing. You might try putting the X39 or an Eon patch right on the bottom of the sternum here, with the on the lung meridian. And doing things that help to open up breathing passages, things like Breathe Easy Tea, or certainly the medication if it's a reactive airway, if there is a spasm of the bronchial breathing passages.
Okay, thank you for that. And that I have been there, so I empathize big time with that one. And I'm so glad to be on the other side. So
Yeah.
would you think Eon might help relax the system a bit?
Eon on that
Eon there?
sorry,
Okay,
yeah, down on that lung meridian.
great, great. Okay, there's a Zoom user that says, I had a knee replacement. Pain medicine made me sick, 7 weeks now. I quit the meds 5 weeks ago. Which patch is best for pain?
I love the X39 for pain. It sounds funny. I don't love pain, but the X39 is very helpful for pain. And of course, the Icewave patch has been very helpful. Post-operatively, there may be some inflammation, and Eon and or glutathione may also be helpful.
Great. Thank you so much for that. And if you go to our Live Younger Success, liveyoungerproducts.com, you go to the top menu bar on the top left and you click on for more information. There's a whole section on pain management where you can access David's webinars on pain management, where he mentions all the patches that Dr. Stewart just mentioned, X39, Eon, Icewave, glutathione, all of them, but David talks about them. So you might want to access that one also.
Excellent, excellent.
Yeah.
Excellent. Highly recommended.
Yes, and I can empathize with that one too, after having had 2 knee replacements, and the second one was a whole lot better because of these patches. Jody wants to know, can the patches be used with a stimulator?
A stimulator, something to stimulate the patch to be more effective?
I don't know what kind of stimulator. That's all she said. So Jody, if you would give some clarification on what kind of stimulator, that would be helpful.
Or did we get anything back on the dizziness?
Let me see. Okay, Meredith said yes, spinning.
Okay.
It's that V word, and it's in his bed. History of ringing in ears, but not made worse by, the virus situation that they're dealing with. Some dizziness in the past, but nothing like this.
Okay, so there's 3 common causes of spinning, and I think I could use the names of these things without attributing a treatment to it, but we will. So there is the
It's tricky, isn't it?
Labyrinthitis, inflammation of the semicircular canals that control our balance. That may be virus or some other similar type entity. And then we'll get a dizziness in multiple, just any kind of movement, any change in position. There is another one that's caused by stone formation, little sand that forms in our semicircular canals. And that is positional. Typically, a specific lying back motion will trigger it. And characteristically, if you keep doing the same movement you lie down and cause it to get dizzy, sit up, let the dizziness go away and go back down again and again. The dizziness will get less and less each time. And that's that characteristic sand. And the other one is a disorder, neurologic disorder, which includes the ringing in the ears and dizziness that come on coincident with each other. They're all treated differently. The patches may be effective for all of them because it's symptom related. And you may try placing patches over the temple area near the ear, over the pineal gland and the center top of the head. I can get that on my camera. Things like X39, glutathione, eon. With the sand, there's actually a technique for positioning the body repeatedly, and it's basically moving the sand out of the area where it will stimulate nerve endings, and that's really very, very curative. It's something that's simple and safe, and definitely I would recommend getting that done.
Oh, well, thank you. I had no idea there's so many causes of dizziness. Whoa. And Jody responded about this. It's a spinal stimulator on the nerve in her tailbone.
Okay.
She says, can the patches be used with the stimulator?
Yeah, I think this is probably a microcurrent stimulator, and yes, they could be.
Great. Wonderful to know. Okay, and Dr. Barnsley Brown wants to know, would you kindly share more about the glycine and copper supplements some may need?
So glycine is an amino acid regularly available in health food stores, typically a 500 milligram capsule or a powder. And with amino acids, 1,500 milligrams a day is a pretty common dosing. Copper often given along with zinc because they work in balance with each other in the body. And maybe 25 milligrams of zinc and 4 or 5 milligrams of copper.
Beautiful. I'm so glad you have the background that you have to answer these questions. We're so lucky to have you. Okay, CH, I think it's CH, said, I was thinking about asking, my friend Denise's son has a bolt in his leg and a lot of pain.
Has a what?
A bolt, B-O-L-T.
Bolt, like someone left a mechanical device in there. Yeah.
Like a nut and bolt. Yeah. What would you recommend?
So if the bolt was put in there intentionally because it's holding a plate, then the inflammation, I would probably use glutathione and eon, and the ice wave to help with the pain.
Great. That combination, is like perfect for just about everybody.
Yeah, I love it as a combination. Yeah.
It's a great one, isn't it?
Mm-hmm.
Okay, so an anonymous attendee saying, I have a customer with a persistent 8-year mouth infection from an amoeba. Is there something else to add to X39 or anything besides you would recommend? She's seen many doctors and tried many protocols to no avail.
I'm trying to go through my 40 years of medical experience and knowledge, and I don't know of an amoeba infection in the mouth, so I'm not quite sure what we're talking about.
So how about adding glutathione to increase the immune system?
Well, perhaps. It's certainly one.
Okay. All right. That's a tricky one for sure.
And yeah, sometimes doctors will use terminology to explain something that may not either be understood correctly or described correctly.
Okay. All right. That makes sense too. Okay. Luis said, my sister fell a couple weeks ago and hit her head. She's been feeling headaches, nausea, digestive problems, sometimes feeling tired for no apparent reason, and feeling heaviness in her head.
She, from what you're telling me, she needs to be evaluated for serious things like subdural bleeding, bleeding under the membrane surrounding the brain. Not something to be ignored.
Yeah, any kind of hitting of the head, immediately get it checked out. And would you recommend the HAT protocol?
I would recommend that we get checked out first. This is
Check
not,
out first. Yeah, find out what it is first. Thank you. That always, especially when you're dealing with any kind of head injury. Rebecca wants to know what could be done for tingling, fatigued feet.
oh, so X39, yeah, I feel like this is monotonous.
Well, it is, and isn't it wonderful that we have something that's so comprehensive?
So X39 also have had good results with the Icewave on the kidney points that we talked about before on the balls of the foot.
Great. Yeah, so X39 and Icewave on kidney 1. Wonderful.
And any engineer would have the same benefit.
Okay. So let's see, we'll take one or two more here. Energy enhancer has to be placed with wearing both X39 and X49 performance bundle, or is it necessary for long-term 12-hour endurance athletes? I don't understand the question here.
So let me just talk about my use of X39, X49 and energy enhancer.
That would be wonderful.
Just so I have used X39 for a couple of years, and when X49 came out, I added that to my regimen, putting X39 on the C7, the back of the neck, and X49 under my belly button as a daily routine, 12 hours on, 12 hours off. On my game days, or if I'm doing a heavy workout, such as a long bike ride, I will use energy enhancers, and I place them at the corner of my chest here, white on the right, tan on the left, and I will wear them at least a few hours before my endurance. And because of my cramping up issues, muscle cramps, I will keep them on overnight. So if I wear them for 24 hours, energy enhancers, it seems to work out well for me.
Great, great. Thank you for that. A man of experience. Okay. Trish says her hands shake a lot. She drinks sodas instead of water. Will X39 help them? I know what you're going to say, but go for it. I think she needs to hear this.
How about if we stop drinking sodas? If these are diet sodas, you're dealing with the neurotoxin, a brain toxic chemical that has many effects. And I would rather people have the 10 teaspoon filled Coca-Cola than a diet soda.
Great. Thank
and
you.
even rather that they don't have any of it.
Yeah, and I really want to thank you for always bringing that up, because David always brings it up too. The patches do their part, we have to do our part.
Yeah.
And you talked about physical and emotional, health practices that are really important, and food is poison or food is medicine. And if we really want to get better, we need to make choices that support that. So we have gone past the half hour, and I want to thank everyone. There's so many more questions. So for those of you that want your questions answered, put them in the beginning of the call. That would be better, because we love answering them, and want to thank you all for attending. A special thank you for sharing your wisdom, Dr. Stuart. We love learning from you. We love having you here. We love you embodying what living younger is all about, and keep up that great work out there on the soccer field and the biking and everything else you do to stay, we got to use these bodies and move them around. So you're a beautiful example for all of us. And
And so are you, Ron. You're doing great.
Huh?
Thank you for
What?
you're doing great. You're a great inspiration too.
Well, thank you. I turned 68 in March, and I'm getting more and more active all the time, and it's
Isn't
great.
it nice? Isn't it just fun?
It's
My-
wonderful. And Gregory's going to be 70 in a few weeks, and very excited, as we're just blessed that we found Lifewave at the time we found it. It's made a huge difference in our lives. And for those of you that are guests this evening, thank you so much for taking the time to be with us. Thank you everyone for being with us. And please get back to the person that invited you, and they will help you get started. There is no risk to start. The patches come with a 30-day risk-free guarantee. If it's just for yourself, we have a wonderful customer program. And if you're the kind of person like me that can't not share, and then I felt a responsibility to share, because most people don't know this technology exists. It's safe, it's natural, it's affordable, but more importantly, it works. And please do get started right away. And thank you everyone for joining us. And Dr. Stuart, love having you. Thank you. Bye,
Good night,
everybody.